I think it is fair to say that for us already, well, our normal life as melanoma patients is already exceptional and out of the norm. And I think one of the first reactions that we got from many patients, not just the melanoma, when COVID arrived, was that they said, well, now everyone feels what we're feeling all the time. In a way, the initial shock, I think, was maybe less, if that is possible, on our community, but was then very quickly replaced by worries about whether they would be able to access their normal treatments. And we have unfortunately seen alterations of treatment schemes, especially in advanced melanoma. So, for example, visits would be delayed or would be cancelled. We have some that have been cancelled like for half a year and never taken off. Scans were delayed. So there is a worry about a discontinuation of treatment. However, overall, I would say I had been worried more than what happened. So I think overall, those who were diagnosed were followed up. Not ideally, but they were followed up. What did not work was those who were just diagnosed or should have been diagnosed. So we really have now people who have been trying to get appointments. And I'm really, really worried that we have many late diagnoses, so many more late diagnoses than we usually have because of this situation. In addition, and of course, while Europe is a very heterogeneous place and countries have dealt with the pandemic in very different ways, but in many places the burden was placed on the cancer patients to shield themselves. So some of them totally blocked themselves off to protect themselves, especially because we knew that ICU capacities in many countries were restricted. And it was very clear that with a stage 4 diagnosis, you would have no chance to even get a bed in an ICU. And our community you're not fighting to survive melanoma to then be killed in COVID. So that situation was scary. I think now everyone comes to the realization that we have to learn how to continue our normal healthcare system activity despite COVID, and that's our hope, that we really get back to it as fast as possible. At the same time, I would really would like to acknowledge our oncologists, because I think what we have seen, especially in advanced melanoma, is the enormous effort these teams have put in to ensure that patients continue to be seen by, for example, setting up additional COVID tests to make sure that both personnel and patients are safe, for moving to telecom consultations very, very fast. So I do feel like that is a big thank you to the oncology community in that respect, to ensuring that patients are followed up.